stethoscope and move it down. And I'm not going to ask you on a test if you did 8 auscultatory pairs or 7, just as long as you're listening to the whole lung. I'm very particular about my heart sounds though, okay? So let's go over them. What did we say the A was? Aortic. It is the second intercostal space, right sternal border. So write it down and then we'll talk about it. Second intercostal space, right sternal border. If you haven't already, I may have already written that down. Okay? So when I say second intercostal space, this is my second intercostal space. Here's rib 1, intercostal space 1. Rib 2, intercostal space 2. Okay? Sternum, right side of the sternum. Second intercostal space, right sternal border. Aortic. Are you with me? What's your next one? Pulmonic. Okay? Where is it?
Left sternal.
Second intercostal space, but it's left sternal border. So the first one was second intercostal space, right sternal border. Second intercostal space, left sternal border. And that is which one? Pulmonic. Okay?
Is that why you said, like when you were showing us, you said that you'll start, then you'll go over, while you're already there, then go down?
That's for your lungs.
Okay.
But you're going to do them at the same time. You're technically not going to do them. You're going to do your lungs and then do your heart.
Okay.
But they are going to be done in the same sitting. Like,
Okay.
you know, you're going to test lungs and heart. Okay? Second intercostal space, right sternal border was aortic. Second intercostal space, left sternal border was pulmonic. What's the next one on our list? Where is it? Third intercostal space,
Left sternal border.
left sternal border. Did your book say what was special about Erb's point? No. Well, I'm going to tell you. It's where a lot of your sounds radiate to. So it's kind of hard to pick up what exactly it is, but it's really easy to hear the heartbeat there. So it is the alternative point if you can't hear the apical pulse in its normal location. You can count on apical pulse at Erb's point, and you can hear the heart sounds really good there. Okay, so Erb's point's kind of a catch-all. You can hear all the heart sounds pretty equally there, so it's a good spot to listen to. So it is the backup spot to check an apical pulse, which we'll talk about in a few minutes, if you cannot hear it at its normal location, which we haven't gotten to yet.
And where your hand is, that's where it is? Okay. Aver's point.
Now your skills book talks about palpating an apical pulse. We don't palpate an apical pulse. We auscultate one. So now we're going down to what? Tricuspid, which is the
Fourth intercostal, left sternal border.
left sternal border, right? Not right as in right side, and right as in correct. Okay? So your tricuspid is fourth intercostal space, left sternal border. What's the last one?
The mitral.
Mitral. What is it?
The fifth intercostal space, left sternal border.
So 1, 2, 3, 4, 5. Is it left sternal border?
Yes.
Midclavicular line. This is your clavicle. It's kind of right down in the middle. It's kind of right up under the breast for females. So you're going to go 1, 2, 3, 4, 5, and go over. Fifth intercostal space, midclavicular line. That is the normal location of your apical pulse.
Mid-clavicle.
Midclavicular is C-L-A-V-I-C-U-L-A-R.
Well, that's the only one I got right on that homework.
Okay? Now, why do we have to name those? Why do you think it's important for you to know when you're listening here, you're listening to aortic?
For blocking.
Because if you hear something abnormal, isn't it nice to know that it's probably related to a certain valve?
Right.
Now, if you're hearing something at Erb's point, is that a good indication of which valve it is? No, but if I said that you had a murmur at the fifth intercostal space, midclavicular line, most likely that is going to be a problem with the
Mitral
valve. Look at there. Right? See how that all comes together? All right, so all pigs eat too much. But you're not going to say that over your patient. If you're going to say anything, you're going to go aortic, pulmonic, Erb's point, okay? For your head to toe checkoff, you will have to tell me anatomical location and show me on the patient. And you will count an apical pulse. So you're going to count it at the 5th intercostal space, midclavicular line, unless it's hard to hear there, and then you're going to go where?
Erb's point.
That's where you put EKG points, right?
Very similar, yes. We have another acronym for that, but we're not going to go over that this time.
But it's a little bit different.
Well, you usually have some grounds, depends on how many leads you're using. If you're just using 3, then yes, it's usually salt, pepper, ketchup is what we use. But same anatomical locations. If you've got a 12 lead, then you've got ground wires too, so you may have more than just those 3.
So you said we're gonna have to list, like, the aortic, we're gonna have to list.
Like
that
when you
it's
come
the
into-
left sternal border, we're gonna have to say all of that?
Mm-hmm.
Okay.
Yes.
Is it okay for us to feel, to make sure we're feeling the correct
Yes.
place?
Can you show the placement again?
So like for checkoffs, I'm not going to do these in my ears, but of course you have to, otherwise you can't hear. I would say, I'm going to listen to the heart now, and I'm going to go ahead and tell you the anatomical positions, and then I'm going to go back and listen. It would be 2nd intercostal space, right sternal border for aortic. 2nd intercostal space, left sternal border for pulmonic, and then Erb's point is going to be 3rd intercostal space, left sternal border, and then I have tricuspid, which is 4th left sternal border, 4th intercostal space, and then I also have your mitral, which is 5th midclavicular line. Now I'm going to go back and listen, and that's what you would do. And then when you got to 5th, you'd be there for a minute because you're going to count an apical pulse there. If you couldn't hear it, then you would just say, I'm having a hard time hearing the pulse here, so I'm going to move back up to Erb's point and count my apical pulse for 1 full minute. Because anytime you count an apical pulse, you do it for 1 full minute. You might want to write that down. If you have a patient that is in atrial fib in the hospital, the new guidelines say you cannot use a manual pulse before you give blood pressure medications that affects the heart rate. You have to do an apical pulse. So an apical pulse is always for how long? 1 minute. And you're going to count, like if you're listening to a heartbeat, 1 heartbeat is a love dove. And we're going to listen to some so that you can hear what a normal heartbeat sounds like. Okay?
Well, that thing that you just said about how you can't give any sort of drugs until you count that heart rate, do you have to count the heart rate before you can give muscle relaxers as well?
No.
What type of drugs did you say?
Like a lot of your blood pressure pills, like beta blockers, especially lower the heart rate. Patients that are in atrial fib have an abnormally irregular heart rate. And if you do it manually, if you do it with just palpating the wrist, sometimes you can miss some beats.
And one other question, on the, 5th mitral, you want us to, when we're doing our checkoff, do the mid-clavicle, we can't do the left sternal border?
It needs to be midclavicular. Feel good?